Today on Hockey Time, we want to welcome in a sports medicine physician from the Detroit Medical Center to talk about hamstring injuries. We're at the point of the season where these kinds of injuries can be a real problem. So let's learn more with Dr. Jon Morasso. Thank you for joining us here on Hockey Time.
Great. Thanks for having me. Happy to be here.
We're going to be talking about hamstring injuries. So Dr. Morasso, how does a hamstring injury occur?
First, the hamstrings are a large group of muscles. There's three muscles that go from the sit bone all the way down past the knee. And just like any other muscle strain, when that muscle or tendon is pulled beyond its normal limit, we develop a strain or a partial tear. So essentially, it's a muscle overload. Either the muscle is stretched while you're trying to contract it, or it's just stretched beyond its normal limit.
Why does there seem to be a high reoccurrence of hamstring injuries in athletes?
Hamstring injuries are the most commonly injured muscle group out of all athletes, especially in hockey players, because hockey players are more quad dominant. So we develop larger muscles in the front of the thigh, and this can lead to a muscle imbalance. So if the original hamstring injury isn't fully treated, then it can put you at more risk for having an additional injury. And in general, the number one predictor for a hamstring injury is having a prior hamstring injury.
What treatments can be done for an injured hamstring? What is the typical recovery time?
In general, there are a lot of different treatments for hamstring injuries and other muscle injuries. But first, we want to rest the area for a short term. And by doing rest, sometimes we'll provide crutches if needed. And then ice, compression, and elevation, those are all important to decrease the inflammation. Sometimes we'll take anti-inflammatory medicines or Tylenol for pain. And then a large aspect of the treatment is going to be physical therapy and strengthening to correct those muscle imbalances. Occasionally, we will use different injection options, especially if we're not getting better as quickly as we would like. And these could range from a cortisone injection or a steroid shot to an injection called PRP, or platelet-rich plasma. And that's where we draw your blood, we spin the blood down, and we take the healing factors of the blood and inject those directly into the injured area under ultrasound guidance. Occasionally, especially for the injuries that occur right next to the bone, surgery can be indicated, but most of the time we can treat these non-operatively.
DMC sports medicine physician Dr. Jon Morasso joining us here on Hockey Time today. We are talking about hamstring injuries. So Dr. Morasso, how do you know when it's safe to return to sport after a hamstring injury?
So that's a great question, and it does depend on the type of injury that occurred. But typically, we want to use a stepwise approach. So one of the first signs is we really need to not have pain in that area. We'd also need to get our muscle strength to be back to where it was, and preferably even stronger than it was prior to the injury to prevent re-injury. We would want to make sure that we go back in a controlled manner. So you definitely don't want to jump back out there and go into a live game situation. You want to be able to work the muscle and be able to go at 100% effort prior to going out into the game, because I do see a lot of re-injuries that way, where we just weren't quite ready, and then unfortunately it restarts that whole clock on the healing and rehabilitation process.
What can be done to prevent a hamstring injury from occurring?
So one of the biggest ways that we can prevent hamstring injuries is to work on our flexibility. So there's importance of doing dynamic flexibility and dynamic warm-ups prior to the exercise or getting out and get on the ice. The other thing is working on muscle imbalance and making sure that we are in good physical condition. These injuries tend to occur later in the game as muscles are fatiguing. And the other thing that's really important is to focus on hydration. Hydration is really important to be doing well prior to the event. By the time the hockey game starts, if you're just working on getting your hydration then it's almost too late, because we need to get that water into the muscle cells for it to be the most effective.
Is a hamstring injury something you can treat at home, or should you see a sports medicine specialist?
So it depends on the severity of the hamstring injury to determine what type of treatment you're going to need. But some signs that the injury may be more severe and where you need to see a sports medicine specialist would be if we're having pain that's persisting for a couple days after the injury, after you've gotten through that initial rest period, if there's any decrease in strength, If there's any bruising in the back of the thigh, sometimes that bruising will start to track down towards the knee. And that's the sign that there's at least a grade 2 or at least a partial tear or a partial disruption of those fibers. Or if there's a lot of swelling in the back of the knee or inability to walk or jog. Those would all be important reasons to seek a sports medicine specialist.
I want to thank DMC sports medicine physician Dr. Jon Morasso for joining us today on Hockey Time.
Thanks a lot. Thanks for having me.
If you have a hamstring or other sports injury that has you sidelined, call the orthopedic and sports medicine specialist at the Detroit Medical Center. Call 1-888-300-DOCS.